So the goals for today, the plan is that we'll go through a little bit the health research data landscape in Canada and some of the challenges and opportunities. Then we'll speak about our two organizations, so Health Data Research Network Canada and the Canadian Research Data Centre Network, and how we can help you navigate this health data ecosystem and data ecosystem in Canada. And then we'll conclude with a question and answer period. So let's jump in. Okay, so the health data research landscape in Canada is a federated landscape where individual provinces and territories manage their health systems and oftentimes also manage associated data that's collected within those health systems or specific systems. And so that can cause some variations in both how the data is collected and structured. And there are also legislative variation in how data can be accessed and used and the different privacy and disclosure requirements across each jurisdiction. This often in turn creates an administrative burden on researchers and clients trying to access and use data for various research purposes. And so, we're here to help with that. And you'll learn more about that in a little bit. There are so many opportunities on the other end for multi-regional research and analysis. Canada has a rich population level data. It's diverse, and there is growing alignment between jurisdictions around, ensuring compatibility between data systems, between data structures, and as well as policy legislation. And so there's so much a wealth of information, and we really do think, it would be remiss if we didn't, make the most of what data is available through Canada. So with that said, next slide, please. We are here to help. CRDCN and HDRN Canada work with you to navigate federated data systems, help reduce and avoid administrative burden for accessing and using this data. We work with you to optimize the use of our rich data sets and this rich resource we have, and help you deliver high impact health research. So, like I said, we're here to help and help you navigate this complex ecosystem. And I'll give a little bit of an overview first of HDRN Canada, and then Grant will speak to CRDCN. So, HDRN Canada, our mission is to bring together people and organizations across Canada for transformative and world-leading health data use. Next slide, please. Our vision specifically is, one of our key strategic goals is to develop and improve services and supports for data access. Next slide. With that in mind, the Data Access Support Hub, DASH, was created to really address this strategic goal. DASH is a service for researchers conducting multi-regional research. It's provided by a coordination team of over 13 data centers across Canada, and we help you facilitate data access and use across the different provinces and territories and pan-Canadian data centers to help navigate local requirements. And it's also important to note that the data are available and accessible through our data centers, and we continue to respect local legislation and privacy and governance requirements across each jurisdictions. Next slide, please. So our HDRN Canada members span from coast to coast. We have data centers from Alberta, so Alberta Spore Unit, ICES in Ontario, Institute of the Statistics of Quebec, ISQ, and we also have pan-Canadian centers that are a part of our network, like Statistics Canada and CIHI. And we also partner with organizations such as CRDCN, again, to make sure that we are all working together in this ecosystem to best support you. Okay, so the Data Access Support Hub simplifies the data access process by providing navigational support and coordination. So, for example, if you have a specific research project in mind, through our online forms, we can help determine whether or not your specific project is feasible for administrative linkage to or to use health administrative data. And from that, you can receive a cost estimate for the requested services, as well as whether or not the specific project that you're requesting, if we have the data in-house to support you, if it's feasible. We also offer a wide suite of centralized resources and tools, and I'll speak to those a little bit later on. But for example, we have a data asset inventory on our website where you can really browse what data is available from our different member organizations. We also work very hard to champion compatible data access processes across the country. For example, we have now streamlined one intake form for multi-regional research projects where researchers can directly input this information in the form, and then we can provide you and assess your project's feasibility and provide you with cost estimates for your project. And I think this is super helpful, especially during times of the grant season and having, tight timelines. It's such a great service to have as you're preparing for funding. Lastly, we bring forward technological solutions. We continue to innovate. We are very active in the space of ideas, so inclusion, diversity, equity, and accessibility. And so all sorts of things can be viewed on our website, all resources and tools. I really encourage you to check it out. Okay, next slide, please. So you may ask yourself, what type of data is available from our HDRN member organizations and data centers? Well, these data centers have and hold administrative data such as hospitalizations, emergency visits, physician billing, drugs data. They also hold clinical data such as electronic medical records. Some data centers also hold specific social data, for example, on migration patterns or on education. We are also constantly working with different partners to acquire new data sources at our data centers. For example, we work closely with the Canadian Longitudinal Study for Aging and CanPath so that we can streamline and make it easier for researchers to access these data sources. And there are also opportunities for you specifically to link your researcher collected data to administrative data through our service, so long as you have the appropriate permissions, consents in place, and agreements as necessary. So when you come check us out and you connect with our team, we can give you all that guidance around what is required based on your specific research project. Next slide, please. Okay, so how do you access our services? Just check out our website and connect with us through our online website. On our main page, there's a request data through Dash or questions and ask us questions. Literally connect with us this way, and one of our coordinators will get back to you within 1 to 5 business days. If you have a specific research project in mind and you require feasibility assessment and cost estimates, we will ask you to complete an intake form that gives high-level details of your research project. And from there, we work with the different representatives where you're interested in doing your research project to return a cost and a feasibility assessment of that project within 10 to 20 business days. So once you confirm that you have funding, that you'd like to move forward with an actual data access request, then in step 3, you can connect with our team and we'll get you to fill out a complete data access request form. And from there, we work with you to make sure you have all the local requirements in place to proceed with your project. Next slide, please. So, like I mentioned, you can simply visit our website, hdrn.ca dash, and you can go on that page to select request data through dash or questions, get in touch with dash to contact our team and to find out how we can support you best with your project in mind. Next slide. So, when it comes to privacy and security, HDRN Canada is very committed to protecting privacy and ensuring the secure use of data across all multi-regional projects. We operate by respecting local privacy legislation in each province and territory, and the data access and use are governed by those specific jurisdictions and their laws and policies. The requirements may vary by different regions, and we help guide you to inform you what are the requirements based on what specific jurisdictions you've selected for your project. So, for example, a REB, so a Research Ethics Board approval, will most likely be needed. A local principal investigator will probably be required that is attached to the project team. If you are requesting that specific linkage with a cohort, a researcher cohort, you'll probably need clear consent or authorization for the use of this data and linkage to administrative data. And of course, most of the data would always be accessed in a trusted research environment. So this is at a high level are the types of ways we uphold privacy and security through our members and the requirements that you would need to have in place in order to move forward with your project. Next slide, please. So the requirements and services do vary between province and territory and Pan-Canadian Data Center. So as you can see, most all of the jurisdictions require a Research Ethics Board approval in order to proceed with your multi-regional research project. Some may require a local or affiliated principal investigator. And there are different also services that may be offered with some of the centers. So some of them offer analytical services while others might not. When you come to us with your project and you've completed an intake form with the high-level details, we can guide you around these specific requirements and make sure that you're ready when you actually have a fully funded project. Next slide, please. So what are the costs? Well, everything up to the intake phase and providing a feasibility assessment and cost estimate is completely free. So that coordination and consultation service is free on our end, and we're very happy to provide researchers this. Once you actually decide to move forward with a data access request and confirm that you've had the funds and you want to access the data, there are cost recovery fees for data assembly, analysis, and the request. So these fees are really dependent on what type of data you need access to, how many provinces or territories or centers do you have involved in your request, do you require project-specific linkage? So these will really determine and change the cost of your request. So once you come to us with your project in mind, we can give you a better estimate to help you create that budget for yourself. Next slide, please. Okay, so we have many supports and resources available on our website. I would highly encourage you to check them out. I spoke to the data assets inventory earlier on, where you can access a repository of all the data assets available through our member organizations or data centers that participate within HDRN Canada. We also have an algorithms inventory, which provides published measures of population health. Again, super useful if you want to reference an algorithm to develop your project. We also have various privacy and legislation tools. One that I would highly recommend checking out is if you're planning to do a project-specific linkage, we do have a resource on our website around consent language for administrative data linkage. We also offer a wide array of resources related to distributed analysis. This is a new analytical method being deployed across Canada that essentially is a method, a way of being able to analyze data without actually having to pool it in one central location. This can be particularly important if you want to have an analysis where the data are, aggregated. However, you can't, share that data between provincial boundaries. So there'll be more webinars coming out in the spring or summer around distributed analysis, but I highly recommend that you check out this great resource we have online. And then finally, if you move to the next slide, next slide. We do offer HDRN Canada office hours. These are free virtual consults with experts within our network that can provide you with advice on methodology, on the data and what's available, as well as support for grant writing proposal. So you can sign up for an appointment online through our website. And again, it's a free resource. Next slide. Okay, some high-level key takeaways. Coming through DASH means that you can leverage a trusted network of experts to give you guidance and support throughout your multi-regional research project. We can provide you quick, easy, and free evaluation of your project's feasibility, as well as cost estimates for your specific project. We provide support for your grant applications, including letters of support if your project is deemed feasible. You can have your information organized into a central place through our systems. And we really offer end-to-end project support throughout the life cycle. So from the moment that you apply for a specific grant to actually deciding to move forward with a request all the way to project closure, we're there to help. We're there to coordinate conversations and move your research forward as best as possible. Next slide. So some quick tips. Please do check out our online resources. There's a wealth of information on our website. As I mentioned, there's the data asset inventory, which gives you all the data assets available through our member organizations, algorithm inventory. We also recommend that if you do plan to submit a project through, to have very clear data requirements and study objectives, as this will help us provide you with the most precise feasibility assessment and cost estimates. And then, of course, please don't ever hesitate to consult our team. Like we're very open and we're here and we have an open door. And if we're not the people to help you with your questions, we'll do our very best to direct it in the right place. So next slide. So just one more reminder. So if you're trying to request data or have questions, you can access this through our main webpage on the Data Access Support Hub, and you can just simply get in touch with us this way. Next slide. And now I will pass it over to Grant, who will speak to the Canadian Research Data Center Network and the data that's available through that service.
Thanks, Carrie-Anne. for having me. Thanks everyone for attending. My name's Grant Gibson, as was mentioned, from the Research Data Center Network. And if you haven't heard of us before, we are one of Canada's major science initiatives. We also get funding from CIHR and SSHRC to provide access to microdata from Statistics Canada. If we could go to the next slide, Jamie. We're actually a network of a bunch of universities, over 40 at this point, that have joined up with the CRDCN in order to provide access to these microdata to their researchers. The CRDCN central team is located at McMaster. It's a small team, there's about 10 of us. But we also have sort of site directors across the country at the 33 labs and at the partner universities that are sort of our boots on the ground there. Generally faculty, but sometimes people from the libraries. Centrally, we coordinate trainings, consultation, programming. So we have a national conference coming up in May this year. You can find out more about that at our website. And we have a slew of training events that we do. Our main mission is to democratize access to the microdata. So in 2020, when we started, the microdata were really only available by access directly in Ottawa at Statistics Canada, and you had to get seed money to go out there and to do your analysis and to work on your project, and that just turned out to really benefit people from Ottawa. So we now have the ability to access data much more locally and are working towards people being able to access data remotely, and I'll get a little bit more into that. We also centrally do coordinations with policy teams. So if you've done work in the RDC and you've told us about it, and we're in conversation with policy people who might be interested in your work, we will absolutely promote it to them. We also have mechanisms by which you can promote your research. So you could create a research policy snapshot, which is a KM vehicle we have destined for policymakers that lets people sort of communicate the high level policy relevant pieces of their research to that audience. And we also have communities of practice, which we call research data and policy circles, which I will put the link for in a second. But that's just a way you can join, express your area of interest. And again, if we have something that's coming up where, your area of research or your area of interest will be implicated, we'll reach out to you about that opportunity or that need specifically. So you can sign up for one of those. Next slide. So for access to the data, all of it is done and adjudicated by Statistics Canada. So you would apply through the microdata access platform. To them, you would tell, a little bit about yourself, your affiliation, your experience and ability to work with the data. And you'd also describe your project. So there's no ethics review required for any CRDCN projects because we fall under the exemption in Chapter 2 of the Tri-Council policy around secondary use of data. But Statistics Canada does adjudicate all those applications for sort of scientific validity and for benefit to Canada. So, your research does have to matter. And it does have to be as an advancement. So there's a lot of things that you aren't allowed to do, like you can't come into the RDC and create a simple crosstab or small table and then leave. It really has to be sort of an involved research project to be working in the RDCs. Once you're approved for access, once that proposal's gone through, you can access the data at the local RDC, although as I mentioned, we're working on some remote access. That is limited to researchers who are employed or who are students of one of our member institutions. So if you're coming in from outside of the network, unfortunately, we're not able to grant you remote access. That's just one of our sort of conditions of operation and part of our 5 safes principle, which I'll get to right at the end. The other thing is that you're sort of expected to be able to work on the data independently. So we don't offer any kind of data services or analytical services. What you'll get is access to sort of the full microdata set with all the variables, and it'll be up to you to sort of structure your analysis. We have a lot of different software that you can use. Most of the statistical software is there, and you can use that to conduct your analysis. The work is free if you are a university researcher within the network, or if you are doing your research in pursuit of a degree. If you're not even within the network. So, if you're at a small institution that's not a member, and you're a student and you're interested in this data, you can still work with it at no cost. If you're doing contract work for the government, or you're doing contract work for private sector, not-for-profits, or if you're sort of faculty at an out-of-network university, there is cost recovery on that. It does tend to be relatively modest in the grand scheme of things. You'll be sort of under $10,000 per year for your access. And if you're motivated, you can probably do your project in less than a year. If you're outside of the university sector, maybe you are a private sector researcher or a government researcher, there is sort of a parallel infrastructure to the RDC network called the VDL and the Secure Data Access Center. So if you're outside of that, StatCan may direct you into that infrastructure instead. If you're, working for a provincial government particularly, or somewhere outside of the university sector. So I just want to flag that we're really sort of the mechanism for university researchers, but that doesn't mean if you're not a university researcher that you can't get access to the data. It's just a slightly different mechanism. It is the same application process. Next slide. So supports and resources. The great thing about the Statistics Canada data is all that difficult harmonization questions that Carrie-Anne flagged about health data. That's all sort of been done by Statistics Canada, a very well-respected and trusted sort of steward and creator of data. So you can have confidence that the data file you're working on has been through the ringer in terms of being standardized and having all those concepts sort of put together as well as they can. The resources pre-application, if you have questions about sort of the proposal process, or you'd like somebody to take a look at your proposal before you submit it, you can work with your nearest analyst. That'll just be at sort of the nearest large university to you, and there's a list of those on our website too. If you're more interested in whether your project is going to be subject to cost recovery, you can come to me. Although if you come to me with any question, I'll be able to sort of answer it or direct you in the right place, regardless. So while I've said that the analysis is sort of up to you in terms of actually conducting it, your analyst can be invaluable in terms of helping you with the rules around the Secure Data Center and the vetting for the output. So before the output can leave the center, it has to be checked. There's some rules that you might not be familiar with, like stochastic dominance testing. The analyst can help you conduct all those sort of checks to make sure that your output is safe. And if you have requests about training resources, we do have a large sort of inventory of events and training sessions that we've done. But if you see something that's missing, you can always make that request to either us or Statistics Canada, and we can help get you set up. Next slide. So on to what data we have. There's over 300 data sets that are available, and there's two ways to search. And because you can't click on these links right now, I was going to post them. There we go. You can search for data that are available either on our website or on the Statistics Canada RDC page. I'm responsible for curating our CRDCN site. So if you want the one that's like guaranteed absolutely, up to date, that's the StatCan page. If you want that one that has a little more detail, that's the CRDCN page. But if I miss something by a week or two, that sometimes happens. So those two ways to search for the data. As far as this, presentation is concerned, most of those 300 data sets are not health related. There's a lot of employment related information. There's a lot of education. There's the census. There's all kinds of other things that are sort of tangential to health. In the health space, we have the discharge abstract data, ambulatory care records, Canadian Community Health Survey, the Health Measures Survey, the vital statistics, so births and deaths, us demographers love that stuff. The CAN checks, which are the census health and environment cohorts. That's sort of a linkage project around the census. The National Population Health Survey, which is a sort of long in the tooth longitudinal health survey. It's the only one in Canada that is done by Statistics Canada. But it is getting a little old. The Canadian Health Survey on Children and Youth, and lots more. Plus, if you have a data set that you're interested in sort of bringing to the census or bringing to one of these other data sets, it is possible to link them to a Statistics Canada dataset. I will caution you, though, that there is cost recovery and privacy impact assessment pieces that go with that, and they can take quite a while to finalize and conduct. So linkage is not impossible, but it is, it is something that takes some time and some effort. Linkage is not, in StatCan parlance, matching on geography. So if you've got a data set where you've got, postal codes or some kind of census geography, and you want to bring that and match those to a StatCan data set at the level of geography, that's not linking. Linking really just refers to, using identifying information to connect one record in a data set to another record in a data set containing the same people. So if you're thinking of just, well, I've got some geography and I'd like to bring that in, that's totally fine, as long as you can get permission from the owner of the data to bring it in. Next slide, Jamie. So how does the whole system work? Just at a high level, we do sort of follow the 5 safes framework to maintain the privacy of everyone that's in the data and their safety. So that's safe people, safe projects, safe settings, safe data, safe outputs. So just to summarize, the safe people part, that's the researcher, and before you'll ever get access to the data, you're subject to a criminal record check, credit check, fingerprinting, to make sure that there's no possibility that your request for data isn't coming from a genuine place of research. The safe projects piece happens at the approval phase, so you submit a full description of what you're intending to do. You're not really allowed to deviate too much from that. So if you can't propose topic A, get access to the data, and then go and request output that looks a lot more like topic C. The safe settings. So you can, if you're part of a member institution, you can access remotely. You can access in person. And there are some restrictions depending on how sensitive the data set is, where you'll be able to access data. So if you're looking at a very, very sensitive data set, the example I usually call on is the prison records. Those are accessible only in person. It doesn't matter who you are. There's controls and rules within the center. So first of all the data is de-identified. So there's no, you won't get anyone's name, you won't get anyone's physical address. And so that helps protect the people in the data. And there's other rules. So there's no internet connectivity if you're in person. If you're accessing remotely, you are sort of at your desk, and if you decide to use the internet, you can. But there are, rules that you're required to abide by around your use of the internet during during your work, and rules about what you are and aren't allowed to sort of copy out of your setting, which is essentially anything. Everything that's inside the secure facility has to stay inside that session in your computer when you're accessing remotely. And the last piece is the safe outputs. So before you can take anything out, there is a vetting review where the analyst will make sure that what you're trying to take out of the secure facility matches all the rules for that data set for the purposes of privacy protection. That generally means that all your output is going to be done applying the survey weights if it's a survey, and that there's other rules around sort of how small a cell can be. So for example, if you're looking at a very rare combination of traits, and you're basing a statistic off of sort of fewer than 5 people, it won't be releasable. Other data sets have higher limits for the minimum number of people that can be underlying any given statistic. But I do generally find myself that, by the time you're at that small of a number, that you should, from a research angle, be very concerned about how representative that might be of the population that you're looking at. So while those things exist, I think the red flag from the research side should go up a lot sooner than the rules will really block you from doing. So thank you. I'll turn it back over to get started on the Q&A, I guess. Oh, sorry, Carrie-Anne has more to say.
I do. Thanks, Grant. Okay, so how do we work together? So there is no wrong door. Researchers can engage either through HDRN Canada and our Dash service or the CRDCN as a first point of contact. And we coordinate behind the scenes to connect you to the right place. So if We review a project and we deem that it probably be best fit through the CRDCN. We'll connect you with Grant and folks at the CRDCN and vice versa. But here are some typical pathways. So next slide. So use HDRN Canada's DASH service if you're conducting multi-regional and or pan-Canadian health and health-related data access, and you require support with the navigation of the data, custodians, access requirements, and governance across Canada. Use the CRDCN if you're looking to have secure access to microdata through research data centers from primarily Statistics Canada master files. Both organizations provide resources and tools for researchers and training and capacity. So again, like I said, engage HDRN Canada if you require data access across multiple jurisdictions and you require coordination with data custodians. Engage CRDCN if you request access to microdata from Statistics Canada master files.